Here we go. Hello everyone, and thank you for watching this program on the new Medicare Quality Payment Program. There's no audio taping or videotaping allowed, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information contained in this presentation is for educational purposes, and it's not intended to be legal advice. We're not a law firm. We do not engage in legal services. Every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it is not guaranteed. A little bit about myself. For those of you that do not know me, we have a lot of people that are listening to this presentation. Many of you are members of Target Coding, so you should know who I am. Hopefully you do. For those of you that do not, again, my name is Dr. Marty Kotler. I am a chiropractor. I practiced for many years, about 16 years before I started my company, Target Coding. Target Coding I began about 10 years ago. And I also am certified in CPT coding. I'm a certified professional compliance officer. That's what those letters are after my name. I have to go for certifications and take continuing education credits, so it's pretty involved. I write articles for chiropractic economics and dynamic chiropractic. I've written many training manuals on chiropractic billing, coding, HIPAA compliance, documentation for chiropractors and for physical therapists. I'm a featured speaker for the Coding Institute, Parker Seminars, Foot Levelers, and I'm a guest speaker at many state association conventions. All right, here we go. One of the biggest changes to the Medicare program in the last 50 years just began on January 1st. 2017. This change is going to affect more than 600,000 providers. Out of the 600,000 providers, about 30,000 are chiropractors. Macra, you may have heard this term, this word, this acronym. It stands for the Medicare Access and Chip Reauthorization Act of 2015. It's basically a law that ended the SGR, the Sustainable Growth Rate Formula, which was really annoying and frustrating for everyone, for patients, for providers, for Medicare. Every year there was this threat that the Medicare payment fee schedule was going to get reduced, 10 to 20%. So every year Congress had to get involved, and it became a mess every year. So Macra ended all of that. So before Macra, hello, Natasha, you on the line? Okay, just everyone hit mute, please, on your phone. So before Macra, Medicare used a fee-for-service payment system, reimbursing separately for each individual service without regard to quality of care. This new system is going to reward providers for high-quality care, efficient care that should lead to better patient outcomes, and it's going to penalize providers who fail to do this. At least that's the idea. That's the premise, the goal of this new program. So Macra created two pathways for provider payment. The first one is MIPS, Merit-Based Incentive Payment System, which will pay eligible doctors based on how they score and the number of performance metrics relative to their peers. The other pathway, which I don't think too many of you are going to get involved with, are APMs, alternative payment models meant to promote high-quality, cost-efficient care by incentivizing doctors who work together toward a common purpose, improving patient outcomes while eliminating unnecessary spending. So those are the two tracks. Now, as a chiropractor, you're going to be choosing MIPS. That's the one that makes the most sense. So, who can qualify for this new MIPS program? Well, DCs can, chiropractors, medical doctors, osteopaths, physician's assistants, nurse practitioners, and many other non-physician practitioners. So a lot of people can participate in this new MIPS program. Physical therapists in this transition year are not eligible. However, in my opinion, because I work with a lot of physical therapists, I'm recommending you continue to submit measures to improve your scores, and you can possibly still receive a payment adjustment. You know, some of this information, although this program is already in effect, some of it may still change a little bit, and there could be some other things coming out. So that's why I recommend you stay in touch with Target Coding, get on our email newsletter list. So about once a month, you get a little coding tip of the month, staying up to date on the latest on billing, coding, and documentation for chiropractic. So as far as a physical therapist goes, even though you're not eligible to participate in this new program in the transition year this year, recommending you still submit measures. You could still receive a positive payment adjustment and enter to qualify in this $500 million money pool. Now, MIPS only applies to Medicare Part B. So think about it. Let's say you are in the state of New York. This only applies to your NGS patients, your National Government Services patients. If you're in Florida, this only applies to your First Coast Service Options plans. If you're in out on the West Coast, if you're in, let's say, California, then we're talking about Noridian. So only Medicare Part B claims do you have to do these measures and report these measures. Aetna, Cigna, Blue Cross Blue Shield does not require this information, at least at the present time. So the shift is supposedly from volume to value. Now, how do you qualify? Now, some of you may be thinking, I don't want to qualify. I do not want to have to do this. I don't want to be involved with this, you know. So how does it work if I, you know, don't want to do this? Or some of you may be saying, I want to do this because I want to get paid more. This is an incentive program. So that means you have an opportunity to get paid more, just like the EHR, meaningful use program. It started off with, it was an incentive program where you can get up to $44,000 from the federal government. Stimulus money was given out. So many providers took care of that. I have a friend, he's a hospital administrator. When he hears incentive money is available, he starts to salivate. He brought in over $1 million to the hospital that he works for just in incentive money. So some of you, this is, you know, good that, you know, you want to get paid more and you're going to try your best. It's going to motivate you to try and do this to get paid more. Others will say, this isn't for me. And I have a feeling, unfortunately, that a decent portion of the chiropractic profession is not going to be interested in participating in this because with the old PQRS program, I've heard from some experts in the field that only 30% of the chiropractic profession participated in the PQRS program. So, you know, I reckon, you know, as far as target coding members and clients, I would say over 90% participated in the PQRS. So, you know, this is going to be an individual decision that some of you, you know, will find it easy to make the decision. Some of you might find it hard to make the decision. Some of you might not have a choice. I'll explain that in a few minutes. So, how to qualify? $30,000 and 100 individual Medicare patients per year. So think about that. Maybe you have to go and take a look at your past couple of years, run some statistics from your software program. Take a look. Take a look at last year and the year before. How many Medicare, individual Medicare patients do you get in a month, a week, a year? Add it up. Is it 100? If it's not 100, then you don't qualify for this program. The other item is $30,000 in allowables. That's not what you bill. It's not what you get paid. Think about it. when you bill Medicare, you may be billing your normal fee, especially if you're a par provider with Medicare, and your normal fee for a chiropractic adjustment, let's say 98940, you normally bill $60. Okay, that's terrific. You could bill Medicare 60. So that's the billed amount. Medicare says, okay, you billed us 60. Well, we only allow 30. And then they pay you 80% of 30, which is $24. So we have three numbers here. We have billed 60, allowed $30, paid 24. It's the allowed amount. You need to go into your software programs and take a look and see, do you think you have $30,000 in allowables coming up this year for your Medicare patients? It has to be 30,000 and 100 individual Medicare patients. It's not 100 visits. You could have 30 patients coming in 3 times a week, so there you're going to have your 90 visits right there. It's not visits. It's 100 individual Medicare patients in a year. So I broke it down to make it a little bit more practical and easier for you to understand. So $30,000 in allowables, we're looking at about 20 visits per week, 100 individual Medicare patients in a year. We're looking at about 8 new Medicare patients per month. And your data will determine your eligibility and fees beginning in 2 years from now. So what you do this year affects your payments in 2 years from now. What you did 2 years ago in 2015 is going to affect your payments this year. So I had mentioned a couple of minutes ago that you may not have a choice. What do I mean by that? As you go through this year, if you are getting 30,000 in allowables and 100, you're on track for 100 Medicare patients this year, you're automatically going to be entered into this MIPS program. So you don't really have a choice. It's going to be based on your numbers. So just keep that in mind. Now, if you're on the border of the 30,000 and 100 Medicare patients per year, my recommendation is to report measures. Because if you don't, you're going to be penalized. We're going to go into the details on that in a few minutes. So if you qualify, payments in 2019 will be either increased, decreased, or neutral based on your composite score. We're going to go through how you're going to be scored in a few minutes. Now, you are considered excluded from the program if you're below the threshold. The threshold is less than 30,000 in allowables or 100 individual Medicare patients. So I have some clients that are going, Marty, I collect way more than $30,000 a year in Medicare payments, but I don't see 100 individual patients in the year, so then you don't qualify. If you don't qualify, it's probably going to result in a neutral payment adjustment starting when? 2019. Now, if you're brand new to the Medicare program, not necessarily brand new, to the chiropractic profession, you could be in practice 10 years, but you've never enrolled in the Medicare program, and you decide you're going to enroll into the Medicare program this year, you're exempt from the program. Or if you're a student just graduating chiropractic college, starting a practice, and you enroll in the Medicare program this year, you do not have to worry about this. Now, you still may want to report measures. It's voluntary. You could, if I've been recommending my clients that even if they see one Medicare patient for the whole year, to still report some of these measures. I'll tell you why in a few minutes. So now CMS has said you can pick your own pace as far as how to qualify or how to get incentive payments. First, if you want to report for the entire year, January 1st through December 31st, and you can still do that in this year, even though the new year has begun, it's not too late. For most of you, and it depends upon when you start reporting, but for most of you, you can report for the entire year if you would like, even though the year has started already, and receive up to a 4% positive payment adjustment plus possible bonus pool money. Your other option is You might say, you know, I don't want to do this full force. I don't want to be bound to this every patient, every, you know, full 12 months. I just want to do this for 90 days. You could pick any 3 consecutive months. Has to be 3 consecutive months, 90 consecutive days. You could pick March, April, May, June, July, August, anytime between January and October. Because after October 2nd, if you haven't reported anything, by October 2nd, now it's too late. So report for a 90-day period, and you'll probably receive a small positive payment adjustment without doing it for the whole year. So I think that most of you will do that one. Now, the other item is if you just want to test the waters, you want to just dip a toe into the water, you could report MIPS with minimal. We're talking about very minimal. We're talking about 1 quality measure or 1 improvement activity, and you will receive a neutral or maybe even possibly a small payment adjustment. Your fourth option is don't do anything. You can choose. I know some chiropractors that will say, I don't want to do any of this. I don't want to be part of this. I don't want to be involved with this. I'll see Medicare patients, but I don't want to report any measures. If you are getting 30,000 in allowables and 100 Medicare patients in the year, then you're going to have a 4% negative payment adjustment. So payment adjustments are based on your composite score and the performance data on the performance information submitted, not the amount of information or length of time submitted. So let's talk about how you're going to score. The first, well, there's 100%. The pie is 100%. Out of the pie, you see in the bottom right corner, 60% of the pie is quality. That's the name of this portion of MIPS. Quality. This replaces PQRS. Many of you should be familiar with PQRS, whether you were reporting PQRS measures or not. You should be familiar with the term PQRS, stands for the Physician Quality Reporting System. So if you are going to continue to report PQRS, that'll make up 60% of your score. So quality is replacing PQRS. What are the 2 measures right now? Again, this might change. I've heard it may change, but right now, there are 2 measures that relate to chiropractic. You may have heard, oh, you have to report 6 measures, and you as a chiropractic provider, based on the CPT codes that we bill Medicare, which are only 3 codes, 98940, 41, and 42. There are only 2 measures at the present time that we are required to report. And they're both considered high priority measures. You could report them through claims or through a registry. And they are the pain assessment and follow-up, that's measure 131, and the functional outcome assessment, that's measure 182. Again, they're both high priority measures. You could report them through claims. What do I mean by that? You could report them on paper claims on your 1500 forms or through your electronic claims submission or whatever way you transmit your claims to Medicare. You could do it that way. Or you could do it through your EHR or through a qualified registry. Now, as I mentioned, I do work with physical therapists and other healthcare providers, especially with my clients that are in integrated practices where you have a medical doctor and maybe an osteopath and a nurse practitioner, a physician assistant. There are other quality measures that pertain to those healthcare professionals. For physical therapists, there are 6 quality measures that they should be reporting. The 2 that I just mentioned, plus BMI, current medications, and then there's a falls risk assessment and a falls plan of care. For medical providers, it's medications and current medications and high blood pressure statistics. So there are 271 measures available. There's the link at the bottom of this slide. You can take that link, put it into your computer, and you will see all the measures. You will see the denominators. You could filter them in which the way you're going to report. So that's this portion of the pie. 60% is quality. The next item that you're going to be reporting on is advancing care information. This is worth 25% of your score. This replaces the Medicare EHR incentive program, also known as meaningful use. So those of you that have been reporting meaningful use over the past few years, and many of you may have gotten that incentive money, that up to $44,000, so you should be familiar with reporting your measures and engagement activities through your certified EHR program. So advancing care information worth 25% replaces the Medicare EHR incentive program, and the only way to report these measures is through a certified EHR software program. So for those of you that do not have one, you will not get credit in this category. Remember, there are three categories. I went through quality, that's 60%. The next category, advancing care information. If you don't have software that can report this, so then you will not get this 25%. Now, reporting depends upon whether you have the 2014 or 2015 editions of a EHR program. There are 15 objectives and measures in this category. Examples include a security risk analysis. So here we go. If you are reporting your meaningful use, but now it's ACI, Advancing Care Information, through your certified software program, and there are a lot of really good ones in the chiropractic profession. We're going to get into software in a few minutes, and I'm going to give you some recommendations as to what you should do regarding software, what questions to ask. So if you've been reporting meaningful use, you've probably have performed a security risk analysis. There are other categories here. There are 15. There's patient access, secure messaging. Go ahead and take a look at your choices. There's the link right there at the bottom of your screen. There's the link. You can go and take a look at the measures and report the ones that are applicable to your practice. The next category is only worth 15%. It's called improvement activities. It's worth 15%. This is a brand new category. This doesn't replace anything. This is a brand new category that was created for this MIPS program, and it's used for care coordination, patient engagement, and safety. You're going to select activities that improve clinical practice and best fit your practice. You don't have to report more than 4. 4 is the most. Now, there are 92 activities available under 9 different subcategories, but you only 4 is the most. Examples: collection on patient experience, patient coaching in between visits, use of patient safety tools. So go ahead and take a look at these choices. Again, these would have to also be submitted through your certified EHR. There's the website. Take a look at them and choose the ones that are appropriate for your practice. And your software company should help you choose the ones that are most appropriate for your practice. I'm going to get into that a little bit more in a few minutes. So now scoring. So scoring for MIPS could be complicated. Over 70 points, you're going to increase your payment and eligibility for bonus money. Anywhere from 4 to 69 points, you're going to get an increased payment but no bonus money. 3 points, neutral payment. 0 points, you're going to get a reduction. It's called a negative payment adjustment of up to 4%. Maximizing your score means putting an increased emphasis on benchmarking against your peers and identifying and selecting high priority measures. You always want to choose high priority measures. Now, your scores will be made available on Medicare's Physician Compare website. This allows patients to go. This is public information. Patients will have access to see how the providers are scoring relative to their peers. There's the website. If you want to go take a look and see if your name is listed, go ahead and download the spreadsheet. I did it. This is a very large spreadsheet. You've heard of Excel spreadsheets containing maybe 100 lines, 200 lines, maybe 1,000 lines. This spreadsheet contains about 500,000 lines. It takes quite a while to download, but you'll see all the providers. And the website is different. Patients can go to the website. Now, I don't think a typical Medicare patient wakes up in the morning and says, my back hurts. I want to go to a chiropractor. I'm going to go to the Medicare Physician Compare website to see who I should go to. I doubt highly a Medicare patient will do that, but this is public information. It would be nice if your name is listed as a provider that has been submitting measures. Now, your reporting options are as an individual. So you could report as an individual or a group. So this is a very important portion right here. If you are the, let's say you're the owner of a practice and you see about 50 Medicare patients in a year, well, you automatically don't qualify. But you have an associate chiropractor that works in your practice under your tax ID number, and your associate also sees 50 Medicare patients in a year. So you can report as a group and qualify for incentive money. If you report as an individual and you're only getting 50, 60, 70, 80, 90 new Medicare patients in a year, or treating, not necessarily new, individual Medicare patients, then you won't qualify as an individual. So think about that. You want to make sure that your PCOS profile is correct, where your associates are signed up to reassign their benefits and you are reporting as a group in order to qualify if you don't think you're getting there individually. Or you could report individually as per your own NPI number. Now, the clinical data may be reported through a variety of reporting methodologies. Claims, qualified registry, certified EHR. Now, if you're with some of the major software programs, they've done a pretty good job in the chiropractic profession of getting people up to date. But if you are not sure, ask your software vendor. Are they ready for this? Are they equipped for MIPS? I've spoken to a few doctors recently where they were told that their software company is not certified. They thought it was, and it's not. They don't have the latest certification standards. Contact your software company. Ask them, are they ready for this? Can they provide you a report card as the year is going on? You might be on that border with the 30,000 and the 100 patients. So as you're going throughout the year, you want to be able to check your statistics. Can your software company create a report card for you to see how it's going? Can they help you generate high MIPS scores without too much exertion? Can you run reports to see data on how, on the quality measures, the allowables, and the amount of individual patients? Now, this is important. Medicare is important. Medicare, thousands of people each day, we're talking about the baby boomers, right? Thousands of baby boomers each day are entering into the Medicare program. Now, some of these individuals are going to opt out of traditional Part B and go into a Medicare Advantage plan, okay? But there's still quite a few that are enrolled in traditional Medicare Part B. Now, you might be saying, well, I don't know if I even want to deal with Medicare anymore. I'm not even enrolled in the Medicare program. By the way, you should not be seeing Medicare patients if you're not enrolled in the Medicare program. Please don't, if you want to, ask a question on that, that's fine. But if you are not enrolled in the Medicare program, you are not allowed to treat Medicare patients. You cannot say, hey, Mr. Miller, come on in. I'm not in the Medicare program. I'm going to give you an adjustment. It's $60. Just pay me cash. I don't deal with Medicare. Just pay me. That's illegal. You cannot do that. So um, if you're not enrolled in the Medicare program, just don't see Medicare patients or get enrolled. It doesn't take long to get a Medicare NPI number. I'm sorry, a Medicare PTAN number. Now, some of you also might be saying, well, I'm enrolled in the Medicare program, but I really don't think I want to see Medicare patients anymore. Just, again, you have the right not to see any patients. You don't have to see cash patients if you don't want to, right? So but what's going to happen is, and this, I speak to my clients all the time about this, this is a doctor that really is not in love with seeing Medicare patients, but you're going to have happy, friendly, lovely patients that have been coming into your practice. They could be cash patients or regular insurance patients, and they turn 65 this year. So what are you going to do? Hey, Mrs. Jones, happy birthday. Now get out of my office because you have Medicare. You're probably going to continue to treat the patient, or you could have, a PI patient coming in, and they've been treating with you and they're happy with your care, and then the case closes and then they turn 65 and now they want to come in. So you're going to get more and more Medicare patients are going to be knocking on your door. That's the point I'm trying to make. So you want to make sure that you have your policies and procedures and you're billing Medicare properly, and you want to avoid, here, let me show you. This came out just a couple of months ago. This is an OIG report that came out that said, Medicare paid out hundreds of millions of dollars unnecessarily to chiropractors. This is based on services in 2013 where they did an analysis and they came up with an 82% error rate. They looked at 105 visits. Out of the 105 visits, they said 11 were medically necessary. The others were not. So they said it ended up being over $350 million in overpayments. Now, I'm bringing this up for a few reasons. One reason is because it relates to Macra. Remember that law that I mentioned earlier? So there was a recommendation as per Macra that as of January 1st, chiropractors whose pattern of billing is aberrant for episodes of treatment that include more than 12 visits, there's a good chance you're going to get audited. So audits are on the increase. Some of you may have gotten a letter recently from a company called Strategic Health Solutions. Some of you maybe have gotten your CBR, a comparative billing report. Here's an example of a provider that, according to Medicare statistics, was way above the average amount in the distribution of visits per patient, way above. So you may have gotten a comparative billing report. Many of my clients received them, and we went over them and discussed them, and I told them what they should do and what they shouldn't do. Some of you have gotten the letter from Strategic Health Solutions. Now, that letter from Strategic Health Solutions was also based on that 2013 OIG report. It's actually a different one. And they want to see notes. They're asking for notes. They're asking for bills. They're going to say that after they receive your information, they're going to send you a letter of determination to see whether they underpaid you or overpaid you, and they may even use extrapolation for refunds. They also said they want to see ABN forms. So you want to reduce stress, right? You want to prevent problems. So you need to be proactive. Medicare expects you to know. The days are over where if you get audited or questioned, you cannot say, well, I didn't know, nobody told me, I practice and I'm a small doctor and I have a small practice. Really, I don't go to my state association conventions. I just stay in my small practice, and I didn't know. That's not an excuse. It doesn't work. Medicare expects you to know, and they could even take it to the next step. They could ask you for proof that you've made an effort to prevent fraud and abuse. Now, if somebody came knocking on your door and said, hey, Dr. Smith, how are you preventing fraud and abuse? You might say, well, we have staff meetings and, I send my I go to seminars, I bring my staff with me. That's wonderful. Do you have it in writing? Do you have it written down? Do you have any type of log? Do you have any proof? That's what you need to do. You have to provide proof that you're making an effort to prevent fraud and abuse. Otherwise, you could be accused of willful neglect. That's a reckless indifference, intentional failure. Again, Medicare expects you to know. Either you knew or you should have known, but you didn't do anything about it. So a couple of things here. Establish a protocol for active treatment. That's the only thing Medicare pays for, active treatment. Do you have a signed HIPAA privacy notice available for review if somebody were to ask? Now, these are the main things that auditors will ask for. Do you have policies and procedures? Do you have ABNs properly executed? It's one of the hot topics. I want to go over that a little bit right now before we open it up to questions and answers. So the ABN, it's a standard notice that a provider must issue to a Medicare patient before providing a covered service. So the purpose of an ABN is to inform a patient that a normally covered service is now not going to be covered. And this allows the patient to make an informed decision as to whether or not to receive the service. What am I talking about? Spinal manipulation. That's the only covered service, right, by Medicare. So if you're going to do an exam, are examinations covered by Medicare when performed by a chiropractor? No. So are you required by law to use an ABN for an exam? No. You can if you want. It's optional. I don't recommend you use an ABN for non-covered services, but the point I need to emphasize here is that you are required by law to use an ABN for a normally covered service, which in this case is spinal manipulation, to allow a patient to make a decision whether or not they want to pay out of pocket for this normally covered service that's now not going to be covered. So it's funny, the Medicare ABN form is a one-page form, correct? Has a 39-page instruction manual. Yeah, I've read it multiple times. You don't need to read unless you have, a burning desire to read about it. Here it is. Go to the Medicare Claims Processing Manual. It's Chapter 30, Section 50. You'll see all the information on the ABN. There's a link on the screen there if you'd like to go check it out. I think most of you will be passing on this, but I read it. I have to read it. It's part of what I do. I actually enjoy reading these items. I know that might sound a little unusual, but this is what I do as an expert in compliance and billing and coding for chiros. So just thought you would find that interesting that a one-page form has such a large instruction manual. This is what the form looks like. You can go and Google this form if you're new to this and you're not familiar with this. Go and Google Medicare ABN form. This is what it looks like. It has 10 customizable areas. Areas A through F, you can complete before you even give to the patient. Area G, the patient must check an option box. Area I must be signed by the patient, and Area J is where the patient must date the form. But a blank form doesn't help you, right? Let me show you what it looks like filled out. So this is the visit. Which visit do you do this on? You wouldn't do it on the first visit unless you have some genuine doubt Medicare isn't going to pay you, but that's unusual that Medicare would not pay you if a brand new Medicare patient comes into your practice that hasn't seen a chiropractor, or, if they, here's an unusual situation. Mrs. Jones comes into your practice, brand new Medicare patient, and she says she just had 30 visits with another chiropractor. Then you would probably want to use an ABN on the first visit because there's a chance you might not get paid. But typically, you're not going to use an ABN on the first visit for spinal manipulation. So what visit? Well, it could be the 10th, 15th, 20th. This is a determination that the doctor has to make. We're not going to get into that right now because that's a whole nother webinar, a whole nother training session. So I call this the good news, bad news visit. The good news, Mr. Jones, is you've reached wellness maintenance. The bad news is Medicare doesn't cover it. Would you like to continue to come in? Mr. Jones says yes. Then you go get the ABN form, put your name, address, phone number across the top. patient's name where it says patient name. The reason your Medicare isn't going to pay because Medicare doesn't pay for chiropractic manipulation of the spine for maintenance care. Make sure you put down the fee that you're going to be charging the patient. Not the fee necessarily you're going to be billing or collect. What are you charging the patient and what are they paying you? That's the important fee you must put on this form. And then the patient has to choose option 1, yes, I want the maintenance but bill Medicare. Option 2, I want the maintenance but do not bill Medicare. So there's the form. And then for the non-covered services, like what? Besides spinal manipulation, everything is non-covered. Exams, x-rays, whatever you do, extremity adjustment, put it on a form like this. Basically says Medicare doesn't pay for all items and services provided in this office, even though we have a good reason to think you need them. Medicare only pays chiropractors for spinal manipulation. Medicare does not pay chiropractors for exams, x-rays, extremity adjustments, modalities, whatever you do. You do orthotics, add it to the list. How about laser, decompression? You sell vitamins to Medicare patients? This is all your flat, normal fee. You don't have to discount this. You don't have to abide by the Medicare fee schedule. And there's a patient acknowledgement at the end. So I just wanted to give you a quick crash course in the proper use of the ABN. Very important. If you want more information on the ABN, we have videos on it and other items. So back to action steps to prevent penalties, to prevent stress. We're all into prevention, right? As a chiropractor, you are naturally into prevention. You're into preventing spinal decay. You're into preventing subluxations. You're into preventing back problems and neck problems, right? So you should be doing the same thing for your practice. How do you prevent problems for your practice, especially when it comes to Medicare? Get your hands on your local Medicare guidelines. It's called the LCD. Read that. Review it with your staff. Log into a training manual that you had this training. Log it in officially. Put it on paper. You had a staff training on the Medicare guidelines for chiropractic. Put it in your policy and procedure manual. Now you have proof. Now if somebody comes knocking on your door, you have something. I'm not saying that's the only thing you should do, and that will, mitigate any penalties, but it's something. I could tell you most of the chiropractors I deal with, not my clients, but most of the non-members of target coding, they don't log any training manuals. They don't have a training manual. They verbally say they do. They verbally say they have a lot of things, but it's not in writing, written down. Attend seminars. Attend webinars. Join your national and state associations. Watch videos. Read books. You should have your data reviewed by a certified coder. I'm picky about this. I recommend you find a certified coder that specializes in chiropractic with at least 5 years of experience. It's my personal recommendation. A chiropractic OIG compliance manual is also a very good prevention tool and can prevent audits and payment recoupment if you see Medicare patients, Medicaid, TRICARE, or any other federally funded program. According to the ACA, Affordable Care Act, an OIG compliance manual is strongly recommended and required. Now, we have a new administration coming into the White House. So some people have been asking me, are things going to change? The answer is no, because Macra, MIPS, all these Medicare guidelines, HIPAA, OIG were passed bipartisanly. So there's not going to be any changes. There may be some changes to Obamacare, but not to these federal guidelines as it relates to providers. So we're going to open it up to questions and answers in a couple of minutes here, but just want to share with you that Target Coding does offer an OIG compliance manual. This is a comprehensive, customizable OIG compliance manual that includes policies and procedures personalized for your practice. We give you chart audit tools and provide you with corrective action plan if necessary guidance. We give you sample training logs, incident report forms, and employee attestations. links, articles, reference material. Now we also offer a HIPAA compliance program, which is totally different than OIG. OIG is about attesting to the fact that you are making efforts to prevent billing errors, that you're making efforts to prevent fraud and abuse. You're aware of Stark laws and anti-kickback and billing properly and using the right modifiers. HIPAA compliance has nothing to do with that. HIPAA compliance is about protecting patient health information. So using the AT modifier properly has nothing to do with HIPAA. HIPAA is about protecting patient health information, and this has become an issue now more than ever. HIPAA has been around for 20 years. HIPAA started in 1996. It's been around over 20 years. Why is it a big deal? Why is it in every chiropractic journal and medical journal that I pick up nowadays? It's all about HIPAA. HIPAA, HIPAA, HIPAA. Everybody's talking because of the hacking that's going on, because of the cyber criminals. It's more important now, because of all the patient complaints, it's more important now to become HIPAA compliant. It's just a federal law. You don't have a choice. It's not optional. You must become HIPAA compliant. So we offer a HIPAA compliance program. It's a comprehensive, we do a comprehensive security risk analysis through specialized advanced software, and we give you a detailed report and action plan. You can store all of your HIPAA policies and procedures in our cloud-based storage system. We have compliance training videos, quick, short, simple, nice videos your staff and all your staff members can watch. And then you want to take it to the next step and test your staff. We can do that. We have videos where you can log in, take your tests online, and you'll get a nice certificate of completion that you can hang on the wall if you would like. We can help you track your business associates. And for a limited time, the HIPAA compliance program includes the OIG compliance manual and training. OIG does not include HIPAA, but HIPAA includes OIG, at least with our service. And then we'll provide you with HIPAA updates, articles, links, reference material. You get 12 months of HIPAA technical support, so contact us if you're interested in that. And the other thing is, for those of you that use billing companies, you know, your billing company must be HIPAA compliant. If your billing company, I'm assuming your billing company has access to your patient data, right? So your billing company might log into your system remotely, and they now can see your patient's names, your patient diagnosis codes, their address, their phone number, their payment information. So your billing company must be HIPAA compliant. So now we do HIPAA compliance for billing companies. So if you're using a billing company, I would ask them if they are HIPAA compliant. Ask them, are you HIPAA compliant? Can you, provide me with your HIPAA compliance manual, or, your proof that you're HIPAA compliant? So now we offer HIPAA compliance for billing companies, and actually for a few other industries that I'll be sharing with you soon that very interesting. So just a few closing comments. Please check with all the carriers you bill prior to submitting claims based on this information. We can't guarantee that this information will guarantee payment from any insurance company or patient. We're not responsible for any rules, guidelines, laws that change following this presentation, and you should realize that changes occur all the time. So it's important to do your best to stay on top of these changes. Get on our email newsletter list, attend our seminars, come to our webinars, join your national and state professional associations. We have seminars nationwide. Many of them offer CE credits. We have webinars on documentation, ICD-10, DME, DCPT integration. We have a whole bunch of webinars coming up on cash plans and personal injury billing coding and documentation, SOAP notes, therapeutic procedures and modalities, managed care. So we have a whole bunch of things coming up this year. I also recently wrote a book. It's a book on the best chiropractic ICD-10 and CPT codes to improve reimbursement. I like this little tagline we put together here. Learning how to bill and code isn't expensive, but neglecting it and defending it is. So we have these cheat sheets that give you the long-term treatment diagnosis codes. We put together these clinical scenarios. We have about 25 of these where you may come up with a diagnosis like cervical radiculopathy. Well, what ortho, neuro, and chiro tests should you do in order to justify that? Because ICD-10 is another thing this year is on the radar screen. This is where carriers are going to be looking at your ICD-10 codes to see if your documentation could support it. The little grace period in ICD-10 is now over. So if you report, like I said, a cervical radiculopathy, do Jackson compression, and do Valsalva or Sperling, do a couple of ortho tests, do a couple of neuro tests to check for dermatomal changes or diminished reflexes, chiro tests, look for subluxations, palpatory tenderness. So that's included with the book. There's also an FAQ. Like a lot of my clients are asking me, Marty, what's the difference between a disc disorder and a disc displacement? What's the difference between effusing, swelling, edema? What's the difference between radiculitis, radiculopathy, and myelopathy? We also offer memberships. We have something called our basic membership. This is amazing because you could pay as you go. For those of you that are just looking for limited information, basically Q&A and access to our live webinars, this is a nice program. It's $99 a month. You can stop anytime. Gold membership is somebody that wants more involved, deep understanding of billing, coding, and documentation. This is for an office that wants to ensure that their notes can pass an audit. This is an office that wants a fee analysis. This is a brand new year. Let's get going on the fees. Am I charging the maximum amount that I deserve? This is for an office that wants a review of their diagnosis codes, CPT codes, intake forms, fee schedules, modifiers, cash plans. Yes, cash. I have more clients signing up lately for practices that are mostly cash than ever before because they're not offering their cash plans properly. They're violating the dual fee schedule. And then we have a platinum membership. As I mentioned, we offer OIG compliance, HIPAA compliance. We also have something called our Smart Choice program, which is a quick analysis, give you an exam, a report of findings, and you're on your way. And we also offer a free coding and compliance evaluation. Just fill out this form and we'll get together, and me or one of my staff members will contact you and we'll do a free 15-minute call to see how you're doing. No obligation, no pressure. We do not pressure. We don't use scare tactics here at Target Coding. We don't pressure anyone. You want us, great. You don't, that's okay. So I want to thank everybody for attending. Here's our contact information: email info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. Our HIPAA secure fax number is 1-844-831-2347. Thank everybody for attending. I hope you learned a lot.